All right. Hey there, and welcome back to the Life with Old Dogs podcast. You may or may not know that February is Pet Dental Awareness Month. It is a thing, folks, and it's a good thing too, because oftentimes we don't think of our dog's teeth at all, let alone the fact that if they have teeth that are not in good shape, it could cause major health problems. So let's talk about it. So, Pet Dental Awareness Month. Now, I'm just going to stick with older German Shepherds, older dogs, because that's what we specialize in here at Woody's Place and the Life with Old Dogs podcast and blog. um, as our dogs age, their teeth wear down and they're susceptible to decay and breakage. It's just like us, really. And again, that could lead to a whole host of problems, from tooth pain to infection to it could actually cause problems with their heart if the infection goes far enough. So imagine being this poor old dog and your teeth are in bad shape and your breath smells awful and you just don't feel well because you have all this bacteria in your mouth and you can't verbalize. This is what's happening. This is how you feel, and this is what's happening. So that's why there's a Pet Dental Awareness Month, to make everybody aware of the fact that you should be checking your older dog's mouth and teeth in particular regularly. When you go to the vet for your biannual or annual visit, which you should be doing biannually if you have a dog older than 8 years old, by the time they get to be geriatric age, 10, 11, 12, they should be going every 6 months, and your vet should be inspecting their teeth. Okay, they should be opening their mouth, pulling their gums back, like it or not, and they should be looking in their teeth for any breakage, excessive wear down, any sort of impact, infection, tartar that's caked on their teeth. They should be inspecting that in your dog's mouth and then addressing it accordingly. So if you don't think of this when you go to your vet, write yourself like a little note or something now. For my dog's vet appointment, insist that the vet check in my dog's mouth. All right, so let's talk about the most common dental issues that our trusted veterinarians see in our older canine companions. The biggest one is plaque. And if you don't know what plaque is basically, it's like when food and gunk cake up on our dog's teeth because they're not brushed regularly, or because they're not eating something maybe coarse that can scrape the food off their teeth. Idealistically, you should be brushing your dog's teeth every day, even if it's just with warm water. You should have a special toothbrush. You could get, they have longer ones. You can get them on Chewy. You can get them on Amazon. Just look up dog toothbrush, but they're on a special angle and they're longer because obviously, you don't really want to be sticking your fingers in there if you have a dog that may bite, although they do have toothbrushes for your finger. But anyway, the heads are a little bit smaller and they're round, and basically you just get in there and you brush in a circular motion. And again, it could just be with warm water. There are other things that you would probably be better to use, but just warm water and just get in there and brush at least once a day. They do have other brushes that if you have a dog that's not going to bite you, you could trust to put your fingers in your dog's mouth. They literally fit over your finger, and they're silicone, and then they have silicone bristles, and you just get in there and brush. I don't find those types of toothbrushes to be idealistic because, number one, we have some residents here and have had residents here that do not want my finger in their mouth. And number two, I have a short finger. I have a short finger. I have small hands. I have a short finger, and it's kind of hard to get back into a German Shepherd's mouth with short fingers. So the brush is definitely better. Again, it's much longer. It's on a specific angle. And I like the brush better. So if you're gonna shop for a toothbrush for an older, larger dog with a larger mouth, not like a flat-faced dog, whether you can or can't put your finger in their mouth, I would definitely go with the brush that has the longer handle on it. So anyway, tartar, or I'm sorry, plaque. That's the biggest right there. Okay, and I just kind of dropped the bomb on the next one. So tartar is the next one. Now, what is tartar? Because oftentimes people think tartar and plaque are like interchangeable, right? Well, plaque is the first step. It's the food on the teeth that doesn't get removed. And then the dog's saliva mixes in with that and it forms like this hard calcified deposit on their teeth. And if you look at it, you could see it's a lot of time, like if you feed your dog kibble, it's like the color of the kibble. And it's so hard on their teeth that you can't really scrape it off with your finger. Sometimes you can. Sometimes if, again, your dog lets you put your hand in your mouth, you can literally like pop it off and you'll see it's in the shape of the tooth. There's actually devices that you could use now to, if your dog, again, lets you and you know what you're doing to scrape the tartar off their teeth. Okay, so we have something here at the sanctuary by My Pet Lab. No affiliation whatsoever. It's just a product that I saw that I wanted to try for the dogs here at the sanctuary. Sorry, the light's on. So this is what it looks like. You could get it on Amazon, and basically it comes with this wand here that is chargeable. Here's the little charger, and you just plug it into a brick that, like your phone gets plugged into, your cell phone gets plugged into. And then it has a bunch of different attachments here. Like, for instance, they have toothbrushes, right? These aren't round. They're nice and soft. And you could just plug it in, and it's like an electric toothbrush. And it comes with 3 different heads. Then there's these devices here. Again, they just get plugged in. Pull this off, and as you could see, it's like a scraper to scrape the tartar off your dog's teeth. There's a few. Here's another one. This is like sort of a different, I don't know if you could see that, sort of like a different angle. Kind of reminds me of a sickle. When I was a kid, we had to sickle a path through all the weeds to get to my cousin's house. And here's another one. It's just that one's a little bit thicker. And again, these get put on, and then this has different speeds, and you get in there and you scrape or push off the tartar or plaque. Little to look inside there. One caveat here. Your dog has to be okay with this. I mean, this is definitely, some of these tools like these, they're sharp. So if you don't know what you're doing, or if your dog is not compliant, please don't try this at home. Please go to your vet and have a dental done by a professional who knows what they're doing, because you could really hurt your dog with some of these instruments. You can impale their tongue with it, or the inside of their mouth. So if you don't know what you're doing, don't use that. But that is what this is for. It is to remove tartar and plaque from your dog's teeth. Again, dog must be okay with you working inside their mouth, and you have to know what you're doing so you don't cause any harmful damage to your dog's mouth. Okay, but those 2 right there, especially the tartar, it's like one of the main reasons why your older dog may have bad breath, because the tartar, I told you, it's just encased. It's like mummified sort of on your dog's teeth. And what's stuck in there with the food particles and the saliva is bacteria. So that is what you're smelling when you smell old dog breath. I mean, there are other reasons for old dog breath too, but that's one of the main ones. And if you think it smells bad, imagine how they feel carrying that around with them 24/7 wherever they go. I mean, don't think for one second that they're not smelling it and tasting it too. It's horrible. It is absolutely horrible. So make sure you get the tartar and the plaque off your dog's teeth. Okay, the next one is gingivitis. So we have plaque, tartar, Now we're up to gingivitis. Now we're talking about gums. All right. So I was talking about the plaque and the tartar and how it's just food and saliva and bacteria and just straight up grossness on your dog's teeth. Well, guess what? That can actually get under the gums as well. All of that funk and just sickness can get under their gums as well. And it can cause inflammation and tenderness and bleeding. I mean, it's the exact same thing as gingivitis in people. And for any of you who may have it, you know it's painful, right? And gingivitis is the first step in periodontal disease, which I'm going to talk about here in a second. All right, but before I do, I just want to talk about an abscess, like a root abscess. So, you have bacteria in your mouth. Let's say there's an exposed root in a tooth, from rot or tooth decay in older dogs, which again is not that uncommon. Now the bacteria gets in there. Now you have an abscess. Have you ever had an abscess? A tooth abscess? Yeah, that's, yeah, it's horrible. It's horrible. And again, now here you are, this poor old dog with this crappy mouth, funk all over your teeth, funk in your gums. And now the funk is in an exposed root because your tooth is so decayed. You have so much pain. You don't want to eat. You're feeling sick. It's just not a good situation. And you can't open your mouth to verbalize to the person who takes care of you, I'm in a lot of pain here and I don't feel well. I need help. Okay, so just another reason why it's really important to brush your dog's teeth regularly and have your vet inspect their mouth, again, biannually or annually. I mean, idealistically, it's a good thing to take your older dog to the vet just for a dental, specifically for that reason alone. You want to look for broken teeth, cracked teeth. I have a friend who adopted one of the puppies from Tawny's litter of puppies, and she happened to be at the vet with the puppy getting its second round of boosters when the vet saw that one of the dog's teeth was cracked, was actually cracked, and my friend didn't know. But puppies are puppies, and they're going to do puppy things. And fortunately, it was just it's a puppy tooth, and it'll get an adult tooth. But yeah, the tooth was cracked, and she had no idea, and it could have been causing pain, and she didn't even know. All right, now moving on to the big one, periodontal disease. That's the biggest dental disease for all dogs, and a whopping 90% of dogs have periodontal disease before the age of 5. What? Before the age of 5? That's not even a senior. But that's because people don't think about their dog's oral care, right? Like, we weren't taught to brush our dog's teeth. That's crazy. Why would you do something like that? We're just going to give them a milk bone or a marrow bone or kibble, and it'll scrape the food right off. Well, maybe to a certain degree, but not effectively. That's why periodontal disease is in 90% of dogs before the age of 5. The age of 5, folks. That's crazy. And here's the scary part. Periodontal disease destroys your dog's teeth, your dog's gums. It even destroys the bones that support your dog's mouth, such as their jaw. Now, there's something to chew on, no pun intended. All right, so all joking aside, periodontal disease is painful and even life-threatening, and that is no joke. All right, I'm going to read you some information about periodontal disease. There are 4 stages of periodontal disease, gingivitis being number 1, about 25% of teeth and bone loss. I'm sorry. Let me take that back. Gingivitis is number 1. Number 2, about 25% of teeth and bone loss in the mouth, around the mouth. Okay. Number 3, 25 to 50% of tooth loss and bone loss. And number 4, more than half of all teeth are loose or missing. Okay. Have you ever heard of a story of a dog like that, an older dog like that? We've had them here at Woody's place. And we've had to have something done about it. And I'll tell you, it's scary when you're told that this 11, 12-year-old dog that you just rescued has to have half their teeth removed, and you don't know much about them, and they have to go under anesthesia, and that's scary in and of itself for an older dog. Um, but that they have to have half their teeth removed. I mean, that is no cakewalk right there for an older dog, but it's a necessity to get them on a healthier track to hopefully go on to live a few more years pain free, at least in the mouth anyway. Now, aside from going and having teeth removed and that whole shebang, is periodontal disease reversible? The only part that's reversible is the very first part, and that's gingivitis. That's the only part of the procession of periodontal disease that's reversible. Once you get past the part the part of gingivitis, and you start moving along the progression where some of the teeth are starting to fall out, some of the bone is becoming is lost, then no, then it's not reversible at that point. And if I'm not mistaken, the second and third stage can be maintained. Okay, if you lose some teeth and some, if I'm sorry, not you, if your dog loses some teeth and some bone loss, stage 2 and 3 cannot be reversed like the first stage of periodontal disease, but it can be maintained. So your poor pup doesn't move on to that fourth and final stage of periodontal disease. All right, so let's talk about what you should be looking for. Again, I think you should be looking at your dog's mouth, inside your dog's mouth regularly. If you have a dog who's not okay with that, I would definitely try to work up to the point where you can start lifting a lip and looking in. And that may take time and training, and that's a whole different podcast. But if you have an older dog, I'm sorry, let me back up a second here. If you can't do that, take your dog to the vet. Take your dog to the vet for a dental exam and have them do it professionally. If you have a dog who's simply not comfortable, you just don't want to do that. All right. You don't want to lose any fingers or anything like that. And I'm just going to go down this little rabbit trail here. It wasn't a dental issue that made me stick my hand in a German Shepherd's mouth, a Woody's Place resident, actually, back in 2012. It was a choking incident. And I couldn't do the Heimlich maneuver. I couldn't do it effectively, and I had just become certified in it like a few months before. But anyway, someone had given one of the residents these pedigree dentist sticks, which are just, we don't even allow them anymore. But back then we didn't know, right? People would donate and we would give these things. And we had this one male German Shepherd, very large, impressive male German Shepherd, great boy, and he choked on it. He was literally choking on it, and I couldn't do the Heimlich maneuver like I had been shown in the training, because he wasn't standing still, number one. He was just like bouncing all over the place, smacking his head against the wall, and it was just this giant melee with like 6 other German Shepherds all gathering around trying to figure out what was going on. So anyway, I looked in his mouth. I opened his mouth, and I could see like the tip of it in the back of his throat, and I stuck my hand in to grab the dentist stick, and he didn't bite me, but he had this gag reflex on the way out, and he bit the top of my thumb off. No shock value there. Sorry. But I just want to make this abundantly clear that if you don't know what you're doing, do not stick your hand in your dog's mouth, because they may not, again, this was not a malicious attack. He literally had this gag reflex and his teeth clamped down, and there went the top of my thumb. This is why, one of the reasons why, when your dog has a dental done, they put that device in their mouth. 1, to keep their mouth open to see what they're doing in their mouth, and 2, because they can clamp their mouth shut, even under anesthesia. Okay, so if you don't know what you're doing, I would implore you, because I know what I'm talking about, don't do it. Don't stick your hand in your dog's mouth if you don't know what you're doing. You have to be able to trust your dog. This is why I don't advocate for those little toothbrush things on the finger, right? I just don't. Use a bigger brush, or again, use, a device like this. Sorry. Use a device like this. I have my phone in airplane mode. Where this is going into the dog's mouth and not your fingers, right? Because you only got 10. And when one's missing or half of one's missing, life's a lot different. All right. So anyway, what are the signs of dental disease in a dog? So I have a list here in older dogs. Number one, the biggest one is bad breath, right? Now, again, there are different reasons. There can be different reasons for bad breath. That is the biggest one. That's, it's like in your face. It'll curl your hair, honestly. With some of these older dogs, like, holy smokes. That breath is really bad. We have to get this checked out. The very first thing you want to do is a dental exam. All right. Another one is drooling. You may see your older dog drooling. Maybe they're just super hungry. Maybe you have like a high value treat that they really want, but maybe they have a broken tooth, or maybe, they have some serious periodontal disease going on in their mouth, and they need to have that addressed. So drooling is another. Bad breath, drooling, reluctancy to eat, especially things like kibble. That's a big one. Oh my, can you imagine? Like, you have this war going on in your mouth, right? With pain and infection and, broken teeth and gingivitis and gingivitis, and it's just a bad situation. And then you're given a bowl of kibble, or one of those hard milk bone nasty treats, and you're like, I can't even deal with just sitting here. Now I'm supposed to eat this hard thing where I really have to crunch down. That's torture. So reluctancy to eat is a big one too. Again, can't chew what they're eating. So they might get to the point where they're just so hungry, and their person hasn't picked up on the fact yet that their mouth is just horrible. Their teeth are so bad, but they're hungry and they want to eat. So they're literally just swallowing whatever is given to them. If it's a bowl of kibble, they're literally just swallowing the food instead of chewing it, just to have something in their stomach. Reluctancy to play with toys is another one. If you have a dog, an older dog, and they love to play with toys, that now they don't want to put it in their mouth, or they like to tug, with a tug toy, and now they don't want to do that. That could be a good indicator to check inside their mouth and see if something's going on. Weight loss. Again, that just goes with they don't want to eat, they're not eating, they're losing weight. The first thing you may want to do is check inside their teeth and check inside their mouth and see what condition their teeth and their gums are in. Rubbing their mouth against things. You may have seen this. Your older dog may actually come up to you and rub their, the side of their face or on your pant leg or something like that, or on a pillow or on the sofa. Maybe they just have an itch. Who knows? Maybe it just feels good, but it also could be a sign of dental disease. Tooth discoloration. So, I look at Sasha right now, and she's 6 months old, and her teeth are pearly white, and she's lost some baby teeth, and, they just look so teeny tiny and cute and just like pearls. They're just so white. And then I see like poor Brutus, and Brutus has a little cat outside the window here. Not my cat. I don't know whose cat it is, but it's up here on the deck. But Brutus has some pretty bad teeth. I mean, they're clean and they're the best that we can get them, but he doesn't have good teeth. Like whoever had him before just didn't take care of his teeth, and they're all discolored, and he has, receded gums and stuff like that. So his teeth are more of like an amber color as opposed to any, shade of white, really. Tartar is another one. All right, we talked about that. The plaque and the tartar. That's another one that you want to look for. That's a big sign right there. Gums are red, irritated, or swollen. That's gingivitis right there. I mean, they're not supposed to be red, irritated, and swelling, and there shouldn't be any bleeding either. I mean, sometimes there might be some bleeding going on, especially if they're trying to eat. Or if you decide you're going to try to brush your dog's teeth, and you don't want to get in there and it's not an excavation thing, it's just gentle circular motion back and forth, on the upper teeth and the bottom teeth, and that really shouldn't cause bleeding. But if there's bleeding going on and it's consistently going on, yeah, that could be dental disease. Missing teeth is the biggest one right there. If nothing has happened, like there hasn't been any sort of incident where your dog picked up a rock and chewed on it and, broke a tooth, or there wasn't any sort of fight or anything like that, they didn't get hit in the face with a hard ball that might have knocked a tooth out. Not that we have that happen here, but sometimes I throw the ball, because Caesar and Sasha love a ball. I'll throw the ball to them, and I feel so bad when this happens, but they don't catch it, and it just hits them in the face. I feel awful when that happens. But they're rubber balls. They're soft. But missing teeth, if they're just falling out, they're just missing, you don't know why, that could be a good indicator that they have dental disease. And another one that may not even come to mind is if they have discharge from their eyes or their nose, that could mean there's something wrong with their teeth. It's kind of all connected. Just like there could be swelling in the face. That could indicate an abscess if they're swelling in the face. And this is a big one too. If you have a dog who's older and they've always been friendly, they've always been compliant, but now they're maybe becoming aggressive and snappy, look inside their mouth. Could be something going wrong with their teeth, and they're not feeling good. And because they can't open up their mouth and say, excuse me, this hurts in here, that's their way of telling you, I'm not feeling good. This really hurts. You gotta help me here, please. So look inside their mouth if they become snappish or aggressive. And I've actually gotten emails. You know what? I don't want to pass judgment, but I've actually gotten emails from people who have said that to me. I've had my dog its whole life. For some reason, now my dog's become aggressive, and I want to send it to the sanctuary. It's like, well, what have you done? What have you done to investigate why your dog is now aggressive? The first thing I say to them is, have you had your dog checked out at the vet? Have you had a full physical, including a dental, done on your dog to determine if there's something, medical going on with your dog that's causing it to act this way? So that is a big one, folks. A big one right there. Snapping or aggressive, and that's not normal. Get them checked out, especially their teeth. And the last one is they could be visibly sick. They could be vomiting. They could have a fever. They could be visibly ill because they have infection in their mouth. It's like a human who has an abscess. And again, if you don't know, then you can't relate. But if you've had something like this in your mouth, That's why when you have an abscess, they'll give you an antibiotic. Your dentist will give you an antibiotic before you have something done with the abscess, and you'll be on the antibiotic while they're taking care of the abscess, and also for a little while after the abscess is being taken care of, because it's infection. All right, so they're the symptoms of dental disease, or potential dental disease, that I came up with. I'm sure there's more, but I don't know what they are. All right. Now, how does your veterinarian diagnose dental disease? Well, the biggest thing is they do an investigation inside the mouth. Okay, hopefully you schedule that appointment for your older dog, whether it's for an overall wellness visit which should include a dental, opening the mouth, looking inside, or it's exclusively an appointment for a dental exam. But the first thing they're going to do is they're going to look inside your dog's mouth, and they're going to check, the teeth, check the gums. Some x-rays may be ordered. There may be things that they're looking for that they can't see with the visible eye through the exam. So x-rays may be in order as well. One of the things when I'm talking about things that they may not be able to see with the visible eye is bone loss. They may be looking for bone loss, and an x-ray certainly will show that. Okay, and then if dental work is required, then she may perform it right then. It typically doesn't happen. Typically, your dog will have to come back for the dental work. If it's an older dog, a geriatric dog, your veterinarian may even require some additional testing be done first to make sure that your dog is healthy enough to have to go under anesthesia and to have the dental work done. We've had that. We've had that through Woody's place, and we've had some pretty old dogs in there. I mean, I think Misty was the oldest, and she was probably about 15 at the time of her dental exam. Misty is a former Woody's Place resident who passed away back in 2017, but she had, I think, like about 6 or 7 teeth that needed to come out when we got her, and she was put under, and I remember being scared, like, okay. But then I just kind of remember thinking, well, I mean, if this is her time, then this is her time, but hopefully she makes it through, and she did. So I was super happy because she went on for 2 more years. She was one of our super duper seniors. She lived to be 17. She's a little girl, just a little girl. She wasn't a big dog. All right. So yeah, that the work, any dental work will probably be a separate appointment after testing is done and a plan is come up with what they're going to do inside your dog's mouth, and you'll get the estimate and then schedule the appointment. All right, but then after that is done, it's imperative to keep up on your dog's teeth. Brushing regularly, really. Just make it part of your daily routine to brush your dog's teeth regularly. And if for some reason you forget one day, just pick up on it the next day. The idea is to make it regularly and not every once in a while, or worse, not at all. Okay, they need their teeth brushed. There's doggy toothpaste that you could get at Chewy. I really don't know what some of the ingredients are in there. Again, you could use warm water and just brush. There's also a recipe. I'll include the recipe in the show notes, but there's also a recipe with coconut oil and baking soda, and then you use something like for abrasion, and maybe like even a little bit of, well, I guess you could use the baking soda for that. You can make it like a little abrasive with the coconut oil. But I'll include the recipe in the show notes. But the idea is to keep up on your dog's teeth. For those of you who feed kibble, which I'm not beating up anybody over that, I've like see enough of that on social media anymore. You're just such a bad person if you feed your dog kibble. We still use kibble. We still use from kibble, and I've seen some reports now about from kibble, which I'm calling bullcrap on, and nothing's been reported. But I've seen some things being said on in one particular group that has lumped from into these bad reports. And I mean, we've used from kibble for over a decade now, like about a decade and a half, and have never, ever once had a bad incident with any bag of food we've ever gotten from, including their treats. Do I wish we could get completely away from kibble? I do. But realistically, we just don't have the funds to get completely away from kibble and do all of home cooked. So Anyway, that's a whole different podcast right there too. So a high quality kibble that will definitely scrape some of the stuff off, but that is also what's contributing to what's going on your dog's teeth, as far as as far as the plaque and the tartar. There are special toys out there that sort of act as brushes against your dog's teeth that can, help them keep their teeth clean. Marrow bones. I love marrow bones. They definitely will help. The idea is to get your dog to produce saliva to clean the teeth off. So chewing's a good one. And again, that's producing saliva, and it's, hopefully cleaning some of the stuff that's on the teeth off. And again, regular dental checkups with your veterinarian is your best defense against dental disease when it comes to any dog, but especially your older dog. All right. So that's it, folks. That's all I have for this week's Life with Old Dogs podcast. And again, it's Pet Dental Awareness Month, the month of February. By the time you're hearing this, is probably the middle of February, but what the heck? It's still February, right? All right, folks. Until next time, be well and brush your dog's teeth.